This is the case for the 2-4 implant. The implant was done a while ago. For whatever reasons, it failed. So today is a redo of that case. We waited 4 months before doing the redo. Today we are planning, I'll show you the case on the x-ray, but we are planning to get bicortical anchorage. So we'll be actually going through the cortical bone as well on both sides. So the base of the implant and the apex of the implant both. So yeah. So this is where the implant was done, the 2-4, and you can see that implant had failed. There was a pocket, and this happened very quickly. This happened within 2 weeks of placement, so it was very early idiopathic failure of the implant. Removed it, and today we are doing the implant again. You can see that's the implant that we've planned. We'll probably put a bit deeper so we can get that bicortical anchorage, so we can get this and this. There might be a bit of soft tissue, so you'll see the case when I do it. We'll be raising a flap and then removing all the soft tissue first and then placing the implant. The surgery is done now. The 2-4 has been placed. I have taken very strategic pictures so you can see when you open up an area where an implant has failed what it looks like. There was all soft tissue in there, so all the soft tissue was corrected really well before the next implant was put through. I also put the implant in slightly deeper to get into better bone as well. But we got a very good torque. We were about 50. That was pretty good. Also, you must have noticed there was a discrepancy on the buccal. So what we did was we raised a flap in such a way that we have more soft tissue on the buccal, and that would help with the discrepancy in the soft tissue over there. So yeah. I'll be seeing him in about 7 to 10 days just for a review appointment. The sutures that I've given are absorbable, and then I'll see him in about 3 months for the implant crown. Thank you.